It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from one of my clients, Emma. And the question in the last episode was part 14 of My sister is in ICU on a balloon pump and ventilated after cardiac surgery. The ICU doctors want to stop treatment against our wishes and let her die. What should we do? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I wanted to continue answering the next question from my client Emma, which are excerpts from one-on-one phone and email counseling and consulting sessions with me. And the question this week is part 15 of My sister is in ICU on a balloon pump and ventilated after cardiac surgery. The ICU doctors want to stop treatment against our wishes and let her die. What should we do? And that's again part 15. You can also access previous episodes in this series of questions here by clicking on the relevant links part 1 to part 14. And if you are watching this on YouTube, just click on the links below, on the link below this video. That'll get you to our website where you can access all the other episodes plus other resources. So in this series of one-on-one phone and email consulting and advocacy sessions with my client Emma, you will get real in-depth knowledge about cardiac failure in intensive care, how it works, the treatment and therapy options, how to wean somebody off the ventilator, and most importantly, you will discover how to not take no for an answer and get strong advocacy. You will witness how I can lead Emma in going from the intensive care team trying to force her and her family to agree to a withdrawal of treatment and in essence killing her sister as being quote unquote in her best interest, to challenge that and the intensive care team having to do everything within their power to save her sister's life and turning the dynamics completely upside down in Emma's favor. That is something that 99% of families of critically ill patients in intensive care will not achieve if they're not looking for advice. And that's what happens when you have the right advice from a professional like myself who knows intensive care inside out and who knows how to manage the dynamics in your favor and who can take the fear away of being intimidated by the intensive care team. So enjoy today's consulting and advocacy session. Scroll down below this video and watch and you can read the one-on-one consulting and counseling session with Emma in the dialogue, and you can access it just below this video. And again, if you're watching this on YouTube, just click on the link below this video and you can read it on our website. So how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you'll learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families in intensive care. Or you can call me, find international phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, and via email by clicking on the consulting tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.